Hello, my name is Nicola Carey and I'm a reader in long-term conditions at the University of Surrey. I'm delighted today to be able to talk about a project that we've been doing in Ethiopia, which is designed to develop a mobile phone-based system to support palliative care patients in this country. And this is a piece of work that we've undertaken with partners in Ethiopia, in both Hospice Ethiopia and the Federal Ministry of Health, the University of Strathclyde, and Hello Doctor, which is a technologies healthcare company based in Addis Ababa. We're also very grateful to have received funding from the Global Challenges Research Fund to be able to allow us to undertake this important piece of work. So just to give some background to Ethiopia, Ethiopia is a very poorly developed country with a very large population of over 110 million people. And like many developing countries, palliative care is in its very early stages, and it currently has very limited provision, with around 6% of the World Health recommendations only in place. There are a number of specific challenges to Ethiopia. One of the main ones is that over 80% of the population live in rural areas, and it's a mainly farming population. At the same time, more of the population are presenting with cancers and with HIV, but the services that are available just can't keep up with this demand. And we know from our colleagues who live and work in Ethiopia, it's very difficult to be able to support patients who need palliative care, and that there is also an absence of any sort of technology in this area to support this group of patients and their family members. So the aim of our work was to explore the views and opinions of various stakeholders in Ethiopia regarding the use and acceptability of a mobile phone app to support palliative care in Ethiopia. So this study is underpinned by the principles of co-design and action research. And I think it's really important to say that throughout we've worked very closely with our Ethiopian partners, many of whom are healthcare professionals, to sort of direct and navigate the project to make sure that the end product is what would be useful in Ethiopia. As you know, there's not much point developing a system that isn't suitable for the country that it's going to be provided in. So the very first step that we've undertaken here is to complete a series of semi-structured interviews with a range of stakeholders. This data was collected in May and June last year, primarily at Hospice Ethiopia and also at a palliative care hospital hub in Addis Ababa. The interviews were conducted by 3 Ethiopian palliative care healthcare professionals. They were mainly conducted in Amharic and then translated into English for the purposes of analysis. And before we undertook data collection, we obtained the necessary approvals in both Ethiopia and in the UK. So we are very keen to speak to a wide range of people who would be involved in the process of providing and or receiving palliative care information in Ethiopia. So we undertook a purposeful sample approach to our study and collected data from patients, doctors, nurses, community volunteers, health officers and financial officers. And the patients were based at the hospice and at the hospital, home care patients, day patients and outpatients. So at various stages of the disease process and the palliative care journey. So following the analysis of the data and the transcribing and the translation back into English, 3 main themes were identified: the current state of palliative care, using mobile phone technology, and the acceptability of a palliative care app. And I'm going to talk about each of those in a little bit more detail here. So the first theme looks at the current state of palliative care. And I think the main thing to say here is that there was total agreement around just the lack of availability of information for patients and their families at present in Ethiopia. A very important fact in Ethiopia is that the amount and type of information is really influenced by culture. So some patients might not know they have cancer or HIV or a terminal illness, but their family member might. And the healthcare professional may or may not tell the family at all, as seen in the quotes here. And I think the last quote at the bottom here from a daycare patient where they say, we didn't know about palliative care. We didn't know he had a diagnosis when he died. We didn't know, and he didn't get any treatment. And I think that really just sums it up about the cultural importance of the way that things are in this country. So we asked people to talk about how they found information on palliative care and how important it was. And so again, there was agreement about the importance of information for both patients and families on palliative care. And there was lots of discussions around the challenges in finding the information. And this is reflected in the quotes that are found on this slide. And I think the quote on the right-hand side here by the community volunteer really sums it up. I will ask and ask again to try and get the information. And then on the other side, they need a health officer who can explain about their sickness very well, what type of pain they have. They don't even know anything about it. So it's really a bit grim for the patients in Ethiopia at present, or can be. So then we asked patients and stakeholders about how they use mobile phones at present. So there was agreement that there were many benefits of using mobile phones for health, and phone ownership in Ethiopia is deemed to be very important. Even the poorest people who have very little money and very poor access to electricity will still have some access to a mobile phone, even if it is a shared phone in a village community. Patients reported that they mainly use the phone for making calls and texts, but interestingly, the other groups of stakeholders and the healthcare professionals were able to talk about a wider range of use of the mobile phone to access apps, social media apps such as Telegram, WhatsApp and Facebook. So they were much more familiar with the potential functionality of what an app could offer to this population, as shown in some of the quotes here. And I think the quote on the right here, where it says, if I don't have a mobile phone, you won't know what happened to me. It's almost like it's part of their body. If they don't have a phone, they're nothing. And I think we're all a little bit like that, but the importance in Ethiopia was even more profound. So the next quote looks about how people access health information. And so basically there was a lot of agreement around how mobile phone technology could be used. And interestingly, there was an assumption from the patients in particular that their carer or family member would use this potential phone system on their behalf, rather than them using it themselves, particularly as they became too unwell or if they were tired or sick in bed. And there was also something around supporting the hidden patients. Now in Ethiopia, hidden patients occur when there is a lot of stigma attached with disease and illness in Ethiopia, particularly ones which are related, could be potentially of a sexual background, such as HIV or some types of cancer. And so patients can be shunned from their family, or they don't even tell their family. So this is what the this is what some of our participants felt, it would actually help this group of patients to be able to access the information because it would remove the stigma for them. We then looked about how acceptable an app would be to support healthcare information in this area of care. And there was agreement again that there was a place for technology to support palliative care in Ethiopia. There was a real concern about internet connectivity in Ethiopia and the potential lack of it. And this is actually a real problem that unlike in the UK and many other parts of the world where we have access to the internet like electricity, in Ethiopia, if there's some political uprising or upset within the country, the government will turn the internet off. And this even happened this year, where the internet was turned off for nearly a month because somebody was killed. So that's a concern about how that would be managed if that actually happened. Another concern was about for people who were less familiar with using the different aspects of the phone and making sure they had adequate training that enabled them to use it properly. I mean, one of the very important things in Ethiopia is the culture, as I've already mentioned. It's a very complex country. It's a very oral culture, and they have 80 languages across the country, although the main language spoken is Amharic. Additional important things to consider were around the spiritual aspects of care, as seen in some of the quotes here, and the need to have the app in different languages, and the need to have information about spiritual fathers and spiritual contacts as a very important part of any sort of system that was developed. People also discussed potential uses of where they thought the app might be useful, and some of these are highlighted here, around unsurprisingly, around how to self-manage some of the symptoms such as vomiting, breathlessness, wound care and diarrhea, around providing education for patients regarding suitable food types, around having pain scales available to sort of assess people's pain, and providing spiritual support, and also providing information on how to use medicines and advice and information on side effects. So all of that has provided really useful background information, and already we've progressed on to the next phase of our study, which has been the development and user testing of the app, and we've called the app the AZIT app, which means we understand in Amharic. And the next phase will report on this initial app development and its functionality and acceptability. And we look forward to doing that in due course. Thank you very much for listening today.